Hi there everybody, welcome to this in-depth video on morphine. This video will cover everything you need to know in much detail. How and when to take morphine, what are the proper indications, what are the proper doses, what are the side effects, but also what are some contraindications and what to do when somebody overdoses when using morphine. I made a shorter, more to the point video and you can find it in the description if it's more suitable for you. And feel free to subscribe for more upcoming videos. So, first a little disclaimer, the video is meant purely informational, this is not medical advice, and if you're looking for medical advice, always contact your own doctor. So, morphine is the generic name of this medicine, but it's known under the following brand names: Maracex, Oramorph, Sendolor, and Roxanol, and there are some more. And it's available in a drink, injection, suppositories, drops, and tablets. And it can be used for several different indications, but mostly for acute or chronic severe pain, but it's also used in dyspnea, which is breathlessness, and acute pulmonary edema, or as pre-medication during or before anesthesia when somebody gets an operation. So how does this medication work? Morphine is an opium colloid that works as an agonist for kappa, delta, and mu opioid receptors. And it binds to those receptors, and then it alters the pain perception somebody has and increases the pain threshold. And this leads to the analgesic effect, but also to the sedation and the meiosis. When you use morphine as a painkiller, always use a step-by-step approach. Go to the next step when there is insufficient pain relief, or when there are contraindications for one of the steps, for example when somebody is allergic, or for specific reasons, which is mostly oncological pain, because that pain is very severe and you start at a higher step. So if you look into the steps, I wrote them down here. Step 1 is always paracetamol. It's cheap, very safe, has almost no side effects, and is quite effective. If this is insufficient, then you go to the next step. NSAIDs like naproxen, ibuprofen, diclofenac, you can combine them with paracetamol. The next step is tramadol, which is a weak opioid. You can also combine it with step 2 or 1. And then the next step would be oral or transdermal strong opioids like morphine or fentanyl. And lastly, subcutaneous or intravenous strong opioids. This is mostly morphine in hospital setting. So, how do you use morphine? You always take it at fixed times, so you maintain a certain level of the painkiller and you do not experience the pain peaks. If you take it orally in a tablet or a drink, then it will work within an hour. And if you take it rectally, it will work in 20 to 60 minutes, so a little bit faster. And the effect will be there for 7 upwards to 24 hours. So it works quite long. How long can you use morphine? As long as you have severe pain. However, after some time, your doctor will advise you to reduce the dose if possible, and under his supervision, you will try to minimize the dose so you will have less side effects. Regarding safety, if you start using morphine, wait 2 weeks before driving to see what side effects you're experiencing, and if you're not experiencing any dizziness or sedative effects, it's safe for you to try driving after 2 weeks. Please do not combine morphine with alcohol because it may increase the side effects you're experiencing and it can be quite dangerous. And for food, there are no restrictions. You combine morphine with any type of food. So, regarding the dose, if you use morphine for acute and chronic pain and you're an adult and you want to use morphine rectally, 10 to 20 milligrams every 4 hours is the correct dose. If you use it rectally, also 10 to 20 milligrams every 4 hours, and parenterally 5 to 20 milligrams every 4 hours. For children from 1 month up to 18 years, the oral dose is 0.1 to 0.2 milligrams per kilogram body weight every 4 hours, and rectally it's 0.2 to 0.4 milligrams per kilogram every 4 hours. Then, if you want to use morphine for asthma, cardiac, myocardial infarcts, or pulmonary edema, then the only correct dosage for adults is intravenously, so this is mostly in hospital settings, and then the correct dose to start would be 2 to 8 milligrams, and then 2 to 6 milligrams every 5 to 15 minutes, as long as it's necessary. Morphine is a very good painkiller, but it also has some side effects. I noted the most common ones here. Some 1 to 10% of all people that use morphine can have any of these effects: anorexia, dry mouth, abdominal pains, dyspepsia, nausea, vomiting, but also confusion, dizziness, headaches, and eczema, urticaria. I will not name all of them up loud. Feel free to pause the video anytime to check them. Warera, so 0.1 to 1% of all people will experience any of these side effects: allergic reactions, vasodilatation, hypertension, pulmonary edema, respiratory depression, but also spasm of the bile ducts, visual disturbances, and some more. Again, feel free to pause the video anytime you want. Also, if you think you may be experiencing any of these side effects or maybe another one, always check your own prescription and contact your doctor if necessary. The use of morphine can also have some interactions with other medications, most notably with alcohol or with other central depressants like gabapentin, anesthetics, antihistamines, tricyclic antidepressants, anxiolytics, opioids, and muscle relaxants. And what it does is it increases the depressive effects on the central nerve system that morphine already has, and may lead to your suppression of your breathing, and also in severe cases to coma and even death. The same can be said for sedatives like benzodiazepines. Co-use, so used together, can increase the sedative effects and also leads to respiratory depression, and in severe cases to coma and death. And therefore always use the lowest possible dose that is still effective for the shortest amount of time, and check on your patient often to see that everything is going all right. Then when you combine morphine with beta blockers, this may lead to inhibition of your central nerve system, and this increases the side effects morphine can have, mostly increases dizziness, headaches, or sedative effects. Then when combined with a MAO inhibitor, this may lead to serotonergic syndrome, and therefore you need to stop using a MAO inhibitor and wait at least 2 weeks before you can start giving morphine, otherwise it's very dangerous. When combined with anticoagulants, this may increase the effect of the anticoagulation. You should take this in mind. And when combined with ritonavir or rifampicin, this may lead to inducing glucuronidation, and this reduces the level of morphine in your blood and therefore will decrease its pain-killing effect. So keep that into consideration. When you want to use morphine but you're pregnant, this may be harmful for you and your baby. It may lead to an opium addiction in the baby or to neonatal absence syndrome, and you should be very careful and only use morphine on strict indication for the shortest amount of time, but avoid it whenever possible. For lactation or breastfeeding, morphine can pass through in the breast milk and may lead to respiratory depressions in the baby and to adverse effects like depression of its central nerve system, so sedation or hallucinations even in the baby. So therefore you shouldn't use it and you should be very careful. There are also some contraindications, so indications where you cannot use morphine because it's too dangerous. I noted them here. So acute respiratory depression and asthma or COPD, brain traumas or skull injuries, delirium tremens or alcoholism, when somebody is in a coma or has a convulsive disorder, or when there are some abdominal problems like bile duct, ileus, acute liver disease, severe abdominal pains, or peritonitis. Then please don't give morphine. When somebody takes too much, morphine can lead to an overdose, and a patient may have pinpoint pupils, respiratory depression, muscle weakness, bradycardia, and hypotension, depression of the central nerve system, aspiration pneumonia, and lastly, a shock. The therapy is for adults intravenously 0.4 milligrams naloxone, and repeat this if necessary, and children is IV 10 microgram per kilogram naloxone. And note that when somebody has an opioid addiction, the use of naloxone may lead to acute withdrawal symptoms. And then my last slide, some kinetic properties. The resorption is orally variable. Rectally it's irregular and incomplete. The first pass is 90 to 40%. Metabolism is mostly done by liver, 70%, and elimination mostly by urine. And it takes your body 2 to 3 hours to eliminate half of the active morphine in your blood. So this was my in-depth summary on morphine. I hope you learned something. If you want a more to-the-point video, find it in the description, and feel free to subscribe for more upcoming videos. Thank you for watching and see you soon.